Restoration is brought to you by
High Sense, everyday prices for everyday people.
Malta Guinness.
Tasty Tom new seasoning powder. Flavor and taste are far.
Use Tasty Tom enriched tomato mix.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie. Thank you, Mommy.
Hello, and thank you for allowing us into your home or wherever you're watching us from. This is Restoration with Stacy. We're brought to you by Kind Courtesy, High Sense, everyday prizes for everyday people. Malta Guinness, yes, my favorite drink. Malta Guinness is rich in B vitamins and it is produced right here in Ghana. Every time you're buying your Malta Guinness, always look out for the proudly made in Ghana sticker. And Malta Guinness is also helping grow our economy because we are right here and we are employing a lot of people and we are helping boost our economy. And I want you to know that anytime you drink Malta Guinness, know that you are adding to the voice of the world saying, let's keep this world clean and greener, because all our cans and bottles are recyclable. So anytime you buy it, know that you're not polluting your environment because all our drinks are bottled and canned in containers that you can recycle. A very big thank you going out to Tasty Tom Enriched Tomato Mix, Tasty Tom Seasoning, and of course, Indomie. Yes, Indomie is always easy on your pocket and easiest to make. So whatever the occasion, breakfast, lunch, dinner, know that Indomie has got you covered. To my glam team, ABS Lux line located on the Dokor Highway, to Stannis on the East Legon Boundary Road, thank you very much. To Tinaj Beauty, thank you for my makeup and hair duties. Thank you for my hair. And of course, our refreshment partner, Zisuza Catering Services. We'll be right back after this break.
Ghana, World Cup no Asayaba. The High Sense, the stadium border. Said the High Sense, Hector Asante Kotoko, and Real Madrid no. Yenim said sana football, and Ghana for your mojo. High Sense in the World Cup in the Black Stars in the Anunti, yeah, more promo on Masobia, SUB Mad. Marco calendar no. Everything 8 June, copy 18th June. Go near your bedroom. Go near your office. Go near your living room. The whole stadium Bible no. But do High Sense TV and the sound system. World Cup way. Show a High Sense TV so. Let's your High Sense sound system so. You want 32 above 116 inch giant screen. Put the TV look on my sound system no. High Sense, MTN Ghana, any DSTV account and more special package. World Cup season way. Uko showroom bisa wasem. For High Sense showroom, Ghana for Nenina. Never would you World Cup promo imu. Kayo everything 8 June, copy 18th June. High Sense, everyday prices for everyday people.
Tasty Tom Tomato Mix. Ofa kakra. Na ye bebre. Fa kakra yan kwani stew dodwa ope.
Tasty Tom dear, it will surely give you value for money. Steak and little is enough to get our desired quantity of stew and soup, and it doesn't color your meat or chicken.
Tasty Tom Tomato Mix inti. Me handwriting and sada. Senane denebia sa netie. Into customers bar never.
I don't compromise on the quality of my food. Use Tasty Tom Enriched Tomato Mix. This advert is FDA approved.
Every child is so unique.
You like no other.
Outstanding in every way.
It's me like no other.
So anytime you walk and play,
you like no other.
You are special like Indomie.
It's me like no other.
Did you know that every child on the planet has their own unique fingerprint like no other?
You like no other. I can play the drums. I'm talented. It's me like no other. I can sing. I can dance. You like no other.
As well as their own unique talents and abilities.
I can cook. I can paint. You like no other. Indomie. It's you like no other.
So every day, in whatever you do, remember you are special in your own way, like no other.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie. Thank you, Mommy. I love my Indomie.
This advert is FDA approved.
Yes, baby.
Honey, men wash you away. Men to take away our
He's eating out again. Nancy, me trying tasting kuyi. Tasty Tom. Add the new seasoning powders about chicken, stew, jollof, shrimp, beef. The way it enhances the natural aroma.
Tasty Tom, dear.
I trust them. And there is no staining of fish, meat, or chicken. When you could just sharp. Me need also.
Tasty Tom seasoning powder.
New aroma.
New taste.
New taste from Tasty Tom new seasoning powder.
Maybe I need
Maybe I'm not for anyway. Tasty Tom new seasoning powder. Flavor and taste are fun.
Did you know that every child on the planet has their own unique fingerprint like no other?
I can play the drums. I'm talented. Like no other. I can sing. I can dance. Like no other.
As well as their own unique talents and abilities.
I can cook. I can paint. You like no other. Indomie. You like no other.
So every day, in whatever you do, Remember, you are special in your own way, like no other.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie. Thank you, Mommy. I love my Indomie.
This advert is FDA approved.
Charlie, again, Guamu. Bring the shit off fast.
Remember shit that your mama made. For home church, all of it, watch it. Back to school.
But did this shit on of a hook me?
It's here.
Enjoy homemade taste of Shito always with Didi Shito. Carefully selected ingredients, no preservatives, no colorants. Didi Shito, if you DNA. This advert is FDA approved.
Wait, your tomato mix. Wouldn't so one on pass. Still loud, what tomato flavor no? No color changing like traffic lights. Devia cocoa, come on.
Tasty Tom dear, it will surely give you value for money. Stay a little is enough to get our desired quantity of stew and soup.
Taste not so dear. On point. Flavor new.
And it doesn't color your meat or chicken. I don't compromise on the quality of my food. Use Tasty Tom enriched tomato mix. This advert is FDA approved.
As we live by the day, our health should remain paramount, because once our health fails, it means we're going. And I'm not sure we all want to live here now. We all want to be here to enjoy the goodness of God and all the blessings He has in store for us. So I have my favorite restoration doctor with me today, Dr. Kalsoum, and we will be talking about head, neck, and oral cancer. Hi, doctor.
Hello.
How I've missed you.
Me too.
Oh, and you look good.
Thank you.
Every time you are here, my audience get excited because you have a way of breaking it down for us to understand. Now we have three things in one: head, neck, and oral cancer. Can we take them one after the other?
Okay, all right. So oral, and then head and neck. So I'll start with oral. So when we say the oral cavity is actually the mouth in normal sense. So the mouth, so it spans from the lips, okay, to the cheeks, to the tongue, and then the teeth, as well as the jawbone. Okay, so that's would give you the oral cavity. Then we have the head and neck. So basically, the oral cavity is a part of the head. So the head is basically what you are seeing. So your skull, and then all the other things within it, all the other internal structures within it. So the internal structures that you can't see may be your larynx. The internal structures that you may not be able to see would be the pharynx or the back of your throat. Okay, and then the neck part of it is basically that junction between where the head is and then your shoulders.
So it's connected.
So what connects the head to the shoulders is the neck region. And when we say oral head and neck cancers, let me break it down by talking about what cancer is basically. So cancer is normally, we would say that when you have a cell and that cell starts to divide in an uncontrollable fashion, and then it grows usually to become a growth or a lump, and that lump would then start to navigate or start to spread to other parts of the body in an uncontrollable fashion. Ideally, when at the cellular level, when the cells are growing, or in a normal, healthy human being, the cells would first divide. Now, when they divide, there's a mechanism, a normal mechanism that help to be able to take away these cells when they age, so that they die out without causing any problems. But in cancer cases, what happens is that these cells will continue to grow. When they grow, there is no mechanism. That mechanism that helps us to know that, okay, these cells have grown and have outlived their time frame. That mechanism is not there to be able to take away those cells. So these cells will continue to grow. These cells will continue to divide in an uncontrollable fashion, and then eventually they will end up causing some disease at the local site. So if we are talking at the mouth, for instance. So they can end up affecting the tongue. And we all know the functions of the mouth.
Yeah.
The mouth would help us to speak in speech. The mouth will help us to be able to breathe. The mouth would also help us in other functions in terms of even the production of saliva is within the mouth. So it will help us with feeding as well. So all of these, in terms of the cancer cells starting to form at any part of these areas that I have spoken about. So imagine it starts at the lip area, because the lip is usually what is exposed to the sunlight. And one of the risk factors which we'll be talking about in shortly is sun exposure to certain areas, and then eventually you may end up developing the cancer if it affects the cells, and then these cells have mutations at the very, very cellular level, and then eventually these cells would become either an ulcer or they will become a lump, and then if you do take a little bit of it to the lab, you are told that there's some cancer. So if it affects the tongue, imagine, it means that even pronouncing certain words will be very difficult. Imagine if it affects part of the gum or where the teeth are. It means that the patient will end up with either some bleeding or will end up with some of the teeth shaking on that side. Imagine if it affects the roof of the mouth or the palate. That may also be problematic. Imagine if it affects the laryngeal region or the larynx. It means that there will be hoarseness in voice. Okay, so depending on the subsites where it affects, then you end up with certain signs and symptoms associated with it. And mind us that what happens is that these cancers, they can happen unnoticed. So we need to have very high index of suspicion to be able to diagnose them or to be able to present very early. When you look at the statistics or the epidemiology, when it comes to oral head and neck cancers, globally, it's the 8th most common cancer that affects every human. And it can start as subtle as just some small ulcer in the mouth or a lump within the head and neck region that is painless. So people may say that, oh, really, this may have been just something may have bent my mouth or something may have actually scratched me, so let me not give it that much attention. But it's important that we know that anytime you have an ulcer and that ulcer persists, it's painless and it persists for more than 2 weeks, please rush to the hospital, because there may be some danger happening, and that's not what we want patients to present with, because most people end up presenting very late. And when they do present at the very late stages, there is little you can do to actually save lives at that stage.
Is it possible to have just one, or they are likely to come together?
Okay, so the oral head and neck cancers, so it's just telling you the sites. Okay, so it can span from the head region, the mouth region, which I have mentioned, or the neck region. Now, once it affects one subsite, it's all considered as oral head and neck cancer, because what happens is that, yes, they are connected. And what happens is that you would want to investigate that area. If you do investigate it, then you can stage it. So investigations would have to do with, okay, I'll look at it. Where is it affecting? What is the size of it? Now, based on the size, there's something we call the T&M staging, where we want to stage it. When we talk about cancers, there are different stages, and staging is very important in the management of cancers. So you would want to stage it in the sense that you get the size of it. After getting the size, you would want to go into the neck region. So when you go into the neck region, you are going to check for the possibility or the presence of what we call lymph nodes. So lymph nodes help you to tell whether this cancer has started spreading, and it's spreading to, so those are the areas that it will start spreading to first, or at its onset. So you would be able to tell the end part of the staging. Then you would want to do other investigations, we want to check the chest. So they'll take a chest x-ray, you do a chest x-ray, you want to check the other bones within the body to be able to tell if there has been some spread to other distant areas. Then you'll be able to have the complete staging of this cancer. Once you have it, we have the early stages and we have the late stages. The early stages are usually the stage 1 and 2, and then the late stages or the advanced stages are stage 3 and stage 4. This staging is very important to help you to design the type of management that the patient would be available for this patient. Most of the time, the management has to do with doing surgeries. So surgery, depending on where it is affecting. If it's affecting the tongue, you would want to do some surgery on the tongue. If it's affecting the lips, you would want to do some surgery pertaining to that. If it's affecting the sinuses, so we do have spaces within the head region. So I'm sure we haven't thought about it before.
Yeah.
If you're walking around and then you don't even feel the weight of your head. And the reason is that you have some air-filled spaces in the head region.
Okay.
And those head-filled spaces, we call them sinuses. So these sinuses help you not to perceive the weight of your head when you are walking. And this cancer can actually affect these sinuses as well. So if it affects the sinus, you would also know that, okay, then you would want to go in and do some surgery to take care of the local disease. And then you can follow it up with other adjunctive therapy or adjuvant therapies, depending. It can be either chemotherapy or can be radiation therapy or can be a combination of these, or it can either be we saying that, okay, let's just manage the symptoms till the end of life. So when I say chemotherapy, I mean that there are certain medications that are strong medications that would go through the veins and then would help go to where the cells are and then kill them directly. Or when I say radiation therapy, what I mean is that we all have taken x-rays before. So when you use these x-rays to target the cancer cells and then you break them or you cause the death of these cancer cells, that is what we mean by the radiation therapy. So these are some of the treatment modalities, and it really would depend on the staging of the tumor. But most importantly, we should talk about the signs and symptoms associated with it.
That was what I was coming to.
Exactly.
Because you spoke briefly about some, but I wanted you to give us a detailed one so you know that, okay, let me watch it.
Watch it, exactly. So the signs and symptoms, one of the most important ones that I would want to mention is when you have an ulcer or a sore. Okay, so let's just say a sore in the mouth that has been there for a while and it hasn't healed for the past 2 weeks or more than 2 weeks. Okay, please don't take it lightly. Quickly rush to the hospital and let it get checked. Another could be that there could be a red patch around an area within, let's say, your cheek or any part in the oral cavity that has been persistent for more than 2 weeks. Please rush and let's get that checked. It could also be a lump. So a lump either in the neck region, it could be that is the first sign for you to be able to spot.
Is it mostly big?
Yes. So it can even be a small lump somewhere within the neck region, anywhere that is unusual, that hasn't been there for a very long time, or it hasn't been there ever. But you just notice it one day, you just wake up and then you notice that there's some lump somewhere. And that lump is painless. And when you check it as well, you notice that maybe it's fixed to the muscles within the neck, and that's or those kind of symptoms that you may pick up. Quickly rush and then let's get that checked. It could also be that the lump is not only in the neck region, it could also be a lump within the mouth itself. So
run your tongue through.
Exactly. Certain times where we often would not even check would be under the tongue because it is hidden.
Yeah.
So under the tongue could be that is where there is some ulcer or there's some lump there. That may also be an indication that let's quickly check this as well before there's something sinister that is happening that we are not aware of. The other sign could also be just some bleeding from the nose. You get it? Just some bleeding from the nose may indicate
is that kind of bleeding different from epistaxis?
Yes. No, so epistaxis is the medical term for bleeding
Okay.
I mean, a nose that is bleeding.
Because maybe someone could have epistaxis and now
Yes.
the person would be thinking.
Exactly.
Okay.
So
is it
epistaxis can have different causes. Could be, let's say that you had some trauma or impact on the nose, or even from an RTA, then you have that epistaxis. But this one, unprovoked epistaxis, then you have it there. That could be a sign that you should quickly go and then have the head and neck region checked. Could also be hoarseness of voice. You have nice voice, you are talking, you are speaking, all of a sudden the voice has changed and now there's some hoarseness related to that. So that could also be that there may be some mass or growth happening within the larynx or the vocal cords, and that may be the first sign that you may pick up when it comes to head and neck, oral head and neck cancers that we are talking about. So these are some of the little signs and symptoms that you may be able to pick up, and there are risk factors associated with them. They just don't happen, but the certain risk factors have been associated with the formation of these head and neck cancers as well.
What are the causes?
Okay, so the causes would marry into the risk factors that I wanted us to talk about. So among them, most of the time, there's something related to the use of nicotine. So cigarette smoking is one of the main risk factors associated with head and neck cancer. So you would know that cancer related to the lungs is not the only thing that you may be predisposed to when you smoke. The other thing is that you can have cancer related to every part of the body, especially the direct aspect, which is the mouth, and then the head and neck region, the other parts of the head and neck region. So smoking or having a significant smoking history is one of the risk factors associated with oral cancers. Another is alcohol use. So alcohol use in the sense that alcohol has many functions. One of them is when you even drink as well as you smoke as well. So if you are drinking and smoking, there's a synergistic effect in that it increases your risk of developing cancer to a double fold than if you are just somebody who doesn't smoke or drink, because it has the potential to cause dissolution of some of these carcinogens within the cigarettes that you are smoking, and then you end up having a higher risk of developing cancer. In fact, WHO has said that initially we say that for males and females, there are a number of units that is acceptable. So usually we say for females, about 7 units is okay, it's acceptable per week. For males, about 14 units. But recent studies have shown that every unit at all is significant. And I'm sure you would ask what units are. So units depend on the alcohol content. So if it has to do with the wines, which are in the teens, maybe 12%, 13%, 15%, a glass of wine is a unit. When it comes to the beers, a bottle of beer is a unit. If it comes to the spirits, a tot is a unit. So you would be able to tell the number of units you are indulging in and then your risk of developing these cancers. Another very important cause is HPV. Because of our sexual practices, you know, now a lot of people are engage in oral sex. So this oral sex, and you have a partner who has HPV. Now this HPV has been implicated in the formation of oropharyngeal cancers. So these oropharyngeals are more of the throat cancers, which is all part of the oral head and neck cancers. So once you have exposure of this HPV, especially when it goes to the throat, then it will start causing, it will attach itself to these cells and then start causing changes, which is the mutations in these cells. And then before you could realize it, a lump may have formed or an ulcer may have formed, which is a cancer of the head and neck region. Another could be that people who have very poor oral hygiene and probably they have a broken tooth, and that broken tooth hasn't been attended to. So it causes constant irritation of the flesh within the mouth. So I open my mouth, I close it anytime I'm eating. I open my mouth, I close it anytime
Just
I'm
like
speaking.
You keep irritating
Good.
the wound.
So it will traumatize one side, and before long, that side would also become cancerous. Yes, so that is also one of the significant causes of oral head and neck cancer. It could also be that people who have false teeth, so people who wear dentures, removable false teeth, that has been there and has been used for a very long time and hasn't been replaced. So now it is wobbly. Because it is wobbly, it is rocking on the bone. So if it is rocking on the bone, it is also causing that trauma, constant trauma. And once you have constant irritation and trauma to one particular side of the oral cavity, chances are that it will start causing changes that we call dysplastic changes. Try to see if it can withstand that trauma, because that trauma is not supposed to be there in the first place. Now, if it changes to, if these cells now become hyperplastic, and then they become dysplastic eventually, then, and the causative factor is still there, you haven't changed it, you are still using it, then it would now become a neoplasm and then cause those changes that would eventually give you a cancer.
Wow.
So these are some of the,
also
sun exposure.
So we'll just take a break. When we come back, we'll talk about the sun exposure, because I'm very interested in that one. We'll be right back after the break.
Ghana, welcome to Asayaba. The Hisense, the stadium border. Said the Hisense, Hector Asante Kotoko, and Real Madrid, no. Yenim says, son of football, and Ghana for your mojo. Hisense in here, World Cup in here, Black Stars in here. Anunti, yeah, more promo on Masobia, SUB mad. Marco calendar, everything 8 June, copy 18 June. Go, near your bedroom. Go, near your office. Go, near your living room. The whole stadium by but two Hisense TV and no sound system. One cup way. Show a Hisense TV so. Let's your Hisense sound system so. You want 32, above 116 inch giant screen. Put the TV look on my sound system right. Did you ever so? As some crap of a tape. I think the Hisense, MTN Ghana, any DSTV account and more special package. World Cup season way. Uko showroom bisa wasem. For Hisense showroom, Ghana for Nenina. Never would you World Cup promo imu. Kayo everything 8 June, copy 18 June. Hisense, everyday prices for everyday people.
Tasty Tom tomato mix. Ofa kakra. Na ye bebre. Fa kakra yan kwani stew dodoa ope.
Tasty Tom dear, it will surely give you value for money. Steak and little is enough to get our desired quantity of stew and soup, and it doesn't color your meat or chicken.
Tasty Tom tomato mix in tea. Me handwriting and sada. Senane denebia sa neti. Into customers bar never.
I don't compromise on the quality of my food. Use Tasty Tom enriched tomato mix. This advert is FDA approved.
Hey Junior, you did this shit, sir.
Remember shit that your mama made. For home cha-cha.
Hey Charlie, you bring home Joe. Nah, no bring home. So just a stop.
To school with Kenke. It's here, come chop today.
Enjoy homemade taste of Shito, always with Didi Shito.
Stop taking all the shit on now.
Carefully selected ingredients, no preservatives, no colorants. Didi Shito, if you need. This advert is FDA approved.
Tasty Tom tomato mix. Ofa kakra. Na ye bebre. Fa kakra yan kwani stew dodoa ope.
Tasty Tom dear, it will surely give you value for money. Steak and little is enough to get our desired quantity of stew and soup, and it doesn't color your meat or chicken.
Tasty Tom tomato mix in tea. Me handwriting and sada. Senane denebia sa neti. Into customers bar never.
I don't compromise on the quality of my food. Use Tasty Tom enriched tomato mix. This advert is FDA approved.
Every child is so unique.
You like no other.
Outstanding in every way.
It's me like no other.
So anytime you walk and play,
You like no other.
you are special like Indomie.
It's me like no other.
Did you know that every child on the planet has their own unique fingerprint like no other?
You like no other.
their own unique talents and abilities.
I can cook, I can paint.
You like no other. Indomie, you like no other.
So every day, in whatever you do, remember you are special in your own way, like no other.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie. Thank you, Mommy. I love my Indomie.
This advert is FDA approved.
Hey, my best customers in here. Yes, baby.
Honey, men wash you why me to take away aba.
He's eating out again. Not saying me trying tasting kuyi. Nyakra. Mama mau new fella.
Tasty Tom seasoning powder.
Tasty Tom. Add the new seasoning powder saba. Chicken, stew, jollof, shrimp, beef. Udi yedriani anete. And more natural aroma. Shamankasa. The way it enhances the natural aroma. It no be small.
So what's the new season powder if it Tasty Tom there? I trust them.
And there is no staining of fish, meat, or chicken. Delicious meals all the time. Where do you go? Just stop. Me need those.
Tasty Tom seasoning powder. Ooh.
New aroma.
New taste.
This is a new taste from Tasty Tom new seasoning powder.
But
Maybe I'm not for anyway. Tasty Tom new seasoning powder. Flavor and taste. This advert is FDA approved.
Wait, your tomato mix. Wouldn't so one on pass. Allow what tomato flavor no. No color changing like traffic lights. They are cocoa, come on.
Tasty Tom dear, it will surely give you value for money. The steak and little is enough to get our desired quantity of stew and soup.
Taste not so dear. On point. Flavor new.
And it doesn't color your meat or chicken. I don't compromise on the quality of my food. Use Tasty Tom enriched tomato mix. This advert is FDA approved.
Castro again, oh, featuring Baby Jet, EBK, what do this BTO?
Teflon suit, intentional luxury. It's worth the hype.
We are back on, no, that's where you're back on, no. We are back on, no, that's where you're back on, no.
Asamoah Gyan, Baby Jet, Ghana mama who offend, wait the first. No retreat, no surrender. Omo feteke, and say Yakuma, Linda, Barbara, Monica, Jessica, Pamela, Sarah, Gift in a diner. Mudina Como, Muyogo, out, Asamoah Gyan, Muyogo, out.
Baby, baby, you they make my mind just cut down.
Ghana girl, come on, Muofe. I did that, then for you get it. Baby Jessie, Sana, Asamoah Gyan, Sana,
now I'm taking over, make no wonder why. My baby so fly, make no ask me why. Cause she keep me going, oh my motivate. My love, my love, my love, my love, my love. Send me a moyen and sana,
Yes, baby.
Honey, men wash you why me to take away aba.
He's eating out again. Not saying me trying tasting kuyi.
Tasty Tom.
Tasty Tom. Add the new seasoning powder saba. Chicken, stew, jollof, shrimp, beef. The way it enhances the natural aroma.
Tasty Tom there. I trust them.
And there is no staining of fish, meat, or chicken. Where do you go? Just stop. Me need also.
Tasty Tom seasoning powder. Ooh.
New aroma.
New taste.
New taste from Tasty Tom new seasoning powder.
But
Maybe I'm not for anyway. Tasty Tom new seasoning powder. Flavor and taste. This advert is FDA approved.
Charlie, again Guamu. Bring the didi shit off fast.
Remember shit that your mama made. For home church all of and watch it. Back to school.
But did she turn off a hook me? Enjoy homemade taste of Shito, always with Didi Shito. Carefully selected ingredients, no preservatives, no colorants. Didi Shito, if you DNA. This advert is FDA approved.
Every child is so unique.
You like no other.
Outstanding in every way.
It's me like no other.
So anytime you walk and play,
you like no other.
You are special like Indomie.
It's me like no other.
Did you know that every child on the planet has their own unique fingerprint like no other?
You like no other. I can play the drums. I'm talented. It's me like no other. I can sing. I can dance. You
as their own unique talents and abilities.
I can cook, I can paint.
You like no other.
Indomie, you like no other.
So every day, in whatever you do, remember you are special in your own way, like no other.
Thank you, Mom, for letting me know I'm special and for making me my special Indomie.
Thank you, Mommy. I love my Indomie.
This advert is FDA approved.
Wait, your tomato mix. Wouldn't so one on pass. Still loud, what tomato flavor no? No color changing like traffic lights. Come on.
Tasty Tom dear, it will surely give you value for money. Stay a little is enough to get our desired quantity of stew and soup.
Taste not so dear. On point. Flavor new.
And it doesn't color your meat or chicken. I don't compromise on the quality of my food. Use Tasty Tom enriched tomato mix. This advert is FDA approved.
Welcome back. I hope now most of you are wondering that so all of this can actually cause oral, neck, and head cancer.
Yeah.
The things we take for granted could actually be the things that take us to places we don't want to. But before we continue, I'd like to say a very big thank you to our sponsors, Hisense, everyday prizes for everyday people, Malta Guinness, my favorite drink. And as I say that, Doc, we've not had our Malta Guinness today. And Malta Guinness is produced right here in Ghana. It's proudly made in Ghana. It's rich in B vitamins, and we are supporting the economical growth of this country because we're here and we have employed a lot of people, which means that we are actually pushing money back into the economy by ensuring that people are paid and they are also using their money to buy things to inject some money in the system. So you see, we are very strategic people. And a very big thank you going out to Malta Guinness because they're also helping us keep our environment safe and clean. This can be recycled. Our plastics can also be recycled. So anytime you buy it, know that you're adding your voice to keeping Ghana and the world clean and greener. A very big thank you also going out to Tasty Tom Enriched Tomato Mix, Tasty Tom Seasoning, Indomie, ABS Lux Line, Stanners Beauty. A big thank you to Hair Duties located in Osu, and I also to Naj Beauty, my makeup artist, and of course, Zesuza Catering Services. Doc, now I'm interested in the sun. What does the sun do to us when we are exposed to it?
All right. So I'll talk about it in the sense that we know we have something we call melanin. We in this part of the world, we are privileged to have something called melanin, and it's protective. It's able to absorb some UV lights, and then it's protective for us. But in people who lack the melanin, example is in albinos. So these albinos do not have the melanin. So the UV light is not screened. So the UV light is absorbed directly on the skin. So once it affects the skin, it starts to cause damages to their cells. And these damages on the cells can then cause the mutations, and then you end up with the cancer as well. And usually you will find it in the head and neck region, mostly because that is the most part of the body that is exposed. As we are wearing our clothes, you notice that it's just our hands and then our
that
face.
Is exposed,
exactly, that is exposed. So that's the part of the body that is most exposed. So you would end up with sun-related or UV light-related cancers more distributed in the head and neck region. So that's why we advise that if you do have, or if you're an albino, or you do have a deficiency in melanin, what you have to do is that you have to make sure that you're almost all the time protecting yourself from the sunlight by covering up, so that you don't end up getting the sun exposure or the UV light, and then that will lead to the propagation of these cancers. And most of the time you have certain types of cancers happening. And these cancers, I don't want to bore you with all our medical terms, but basal cell carcinomas are mostly the ones that you would see in such patients. And even some people that may use certain topical steroids. So if you use some topical steroids, it also reduces the melanin that you do have, and then it predisposes you to having to react to all the stresses because you don't have the stress hormones at that time to be able to withstand the sun exposure and what have you. So such patients who have topical use of these steroids also are at higher risk of developing some of these cancers when they have the skin exposed to the UV light.
Can it be prevented?
Yes. So definitely it can be prevented. And prevention is almost all the time what we want most people to know about so that you don't end up presenting at a very late stage. So how do I prevent myself from getting oral head and neck cancers? Mostly is lifestyle modification. So lifestyle modification, it means that is if I can stay away from taking alcohol, so be it. But if I do want to still take in some alcohol, you do have to take it responsibly and in moderation. Smoking, very important. You need to cease smoking if you are smoking. The other thing is that if it comes to this sexual habits that we do have, I would say that most women or even males, you should stay away from oral sex because it has so many problems that it can predispose you to, from oral cancers to even cervical cancers and all of those. So you need to stay away from that. And then also, you need to make sure that you are screening yourself. And that is where I see there is gap in knowledge. A lot of people do not know, just like we do for breast cancer every October, we do for cervical cancer every January. You know, you should be able to check and then screen yourself for oral head and neck cancer. And how do I do that? So all you need is a mirror in front of you and then a clean finger or a hand. The first thing you do, you stand in front of the mirror and then you check. So you can mark your calendar at least one day within the month that should be designated for that. So if I'm doing it every first of every month, I stick to that. First of every month, I am doing that. So you stand in front of a mirror and then you have a clean finger. So the clean finger, the first thing that you do is that you would want to check. So you are checking the facial region, you are checking your neck. Is there any unusual lump that you can visibly see? That's the first thing.
The finger can be uncomfortable. Can't you use something like a spatula?
You
that's
can use
flat?
yes, you can
Then
use
it's
a
not
spatula as well.
uncomfortable, yeah.
But then when it comes to just like we do for breast cancer, you look first.
Yeah.
After looking, you need to touch.
Yeah.
Medical terms, we call it palpate. So that's why I say that, okay, so you need an examining finger to be able to touch. So if you're not comfortable with your bare finger, which is anyway your mouth, then you can get some gloves so that you would be able to do the examination by yourself. So you first look. If you are looking, you are checking, is there any lump anywhere that is visible? And then you turn your neck. When you turn your neck, there's something we call the muscles. There are two muscles that help you to turn your neck. We call them the sternocleidomastoids. So it helps you turn your neck either to the left or to the right. And there are lymph nodes just beneath it. So certain times when it's in action, you may not be able to perceive the swelling or the lump. So after looking in the neutral position, you would want to turn your neck to tense one part, and then you still watch to see, has any lump popped up or has anything become much more obvious than it was before. Then you turn to the opposite side as well. Once you are done with your inspection, so that would have given you the inspection aspect of it. Once you are done with the inspection, the next thing you would want to do is that you would want to open your mouth and also inspect. So that is when the finger comes in. So you open your mouth wide with some good light source. Then you start to inspect. So where are you inspecting? You're inspecting from the lip. So from where I have painted, we call it the vermilion border. So from the lips, you are checking all the lips, and then you are going into the mouth. So the mouth, you look at the cheek area, you look at the tongue area, you look at the the floor of the mouth by raising the tongue, and then the roof of the mouth by bending your head a little backwards to see. And what am I looking for? I'm looking for any ulcer. I'm looking for any changes in color. I'm looking for any lump that is obvious there. Once I have done that and I'm okay with it, then I would want to check I would want to now stick my finger and then palpate any abnormal areas I may have seen. Maybe there's some patch, a reddened patch or a whitish patch somewhere. I would want to check to see. Mostly you would find that that area is firm. So if it's firm, quickly, that is a sign that you need to quickly go and then have a look at it. Then you would also want to look inside the nasal cavity to see if there's anything there. And then you start to touch after coming out of the mouth. Then you touch the neck region as well to see. Aside looking, probably when you touch with your finger, you would be able to perceive any lump or you would be able to perceive any mass that is there. So once you do this and then you raise your tongue, you check for it, then you would have completed your self-examination to screen yourself from oral head and neck cancers. And you need to repeat this every month so that you would be able to catch any little thing that may be starting in the mouth without knowing. Very important, the floor of the mouth. And that you can only see or feel when you raise the tongue. And when you raise the tongue, you would be able to see, because most of the cancers that do start at that subsite are very dangerous because you have a lot of blood vessels there. And the moment it starts and you don't catch it early, before you notice, it has spread to various parts of your body and the treatment becomes much more complicated. Yes.
Let's say someone did not get wind of it early and is found wanting. Can it be managed, and how is it managed?
Okay, so management, yes, it can be managed. The management would have to do with the staging, as I mentioned. So if they are early stages, you can go in and have surgery. So surgery to be able to take care of the area that has been affected. And then you follow it up with either adjuvant therapy, which is chemotherapy, or radiation therapy. But when it's at an advanced stage, oftentimes it becomes difficult. So what we would want to do at that stage is that we would want to manage to be able to make life a little comfortable. By that I mean now you use the mouth to breathe, you use the mouth to talk, you use the mouth to eat. These are all very important functions for you to be able to live. So what may be happening in terms of this cancer? Is it affecting the speech? Then you would want to do something to make them so that you are able to manage for them to be able to still speak. Is it affecting swallowing, feeding? Then it means that, okay, what I can do is that then I may have to give a feeding tube so that it can still be able to be fed through the tube. Is it affecting aside the speech? If it's affecting the airway, you are unable to breathe, then I would want to do something to relieve the airway so that you can manage the symptoms and not necessarily treating the cancer, because it's gone beyond you treating and then giving curative management, but rather you would want to just manage the signs and symptoms to make the person comfortable and to make the person to make the person able to spend some quality life with their relatives as we are awaiting the time. You know what I mean? Yes. So that's basically what you do. You would want to make it, and that's, we have a specialized team that are able to do that and do it so well. And that's the palliative team. They're able to, and certain times these patients would be in so much pain. So you would want to manage the pain as much as possible as well, so that they are able to have some good quality life, even though you are not treating and then you don't have curative intent for these
At
patients.
least you make them comfortable.
Yes.
Is there any age bracket?
Okay. Yes.
For this.
Yes. So surprisingly, when you look at literature, it tells you that mostly people who are 35 years and above. But I can tell you, I have seen patients who are 20, who are like the age bracket has actually become some younger people. And most of them have been related to the sexual habits. And mostly it affects the males. The males because we know their habits. But then now we have a lot of females who are also affected. And younger ones for that matter. And these younger ones, when you go into their history, you notice that there's some relationship with HPV. And that is where the worrying aspect of it is.
Yes.
So there is an age bracket which is there. But now what you see on the ground, or most people who come
in
to the
reality.
hospital, in reality, is actually not, it doesn't fit the
What the
middle age.
literature
Exactly.
is preaching.
Exactly. Which is the middle age. No. But rather it's affecting younger generation, and then even more females are seen to come down with these cancers. So the ball is actually in our courts now for us to take control over our own health and make sure that the known causes and the risk factors, we make sure that we have, we are doing what we should be doing and not what we shouldn't be doing, like indulging in all the risk factors that I have mentioned in the past few minutes.
Thank you very much, Dr. Kalsoum. It's always a pleasure to have you. And it's how you break it down. And most of the time, you actually bring our attention to medical conditions we do not even think of. So thank you very much for coming. A very big thank you to our sponsors. Hisense Everyday Prizes for Everyday People. Malto Guinness, Tasty Tom Enriched Tomato Mix, Tasty Tom Seasoning, Indomie. Very big thank you to all of you. ABS Lux Line, Tenach Beauty, Stanners, Hair Duties, the Souza Catering Services. I'm eternally grateful to all of you. Always do remember, you can do all things through Christ who strengthens you. We'll see you next week.